Now, healthcare services were disrupted as clinical officers began their strike to protest the exclusion of clinical officers from SHA empanelment and failure by the government to honor return to work agreement. Health PS Harry Kimtai called on the Kenya Union of Clinical Officers to call off the strike, assuring them that their demands will be met immediately.
Scores of patients seeking healthcare at the Coast General Hospital in Mombasa were left stranded on Monday due to the ongoing strike by clinical officers. The patients who were seeking treatment for various ailments were turned away from the largest healthcare facility in the Coast region owing to a severe shortage of healthcare workers.
Ministry of Health lazima iangalie mambo kama hayo. Hii migomo imezidi hata kwa mashule pia inakuwa ni shida ushaona. Kwa hivyo serikali iangalia mambo kama hayo. Hizo ndo service tunataka sisi tupawe.
Nurse sijawaona ila doctor nimemwona lakini ameniambia niende nirudi Wednesday. Inaathiri afya ya mtoto, manake mtoto ana shida kwa spinal cord. Anafaa vishwe belt ili mrestrain akae vizuri darasani.
The clinical officers accused the government of perpetuating an illegality by locking out facilities registered under the Clinical Officers Council from SHA pre-authorization and empanelment. The union's chair, Peterson Washira, says a meeting called by the Health CS earlier today failed to yield any fruit, and the strike will remain in force until all their demands are met.
Why should we negotiate a CBA for close to 7 years? And yet a CBA has a life cycle of just 4 years.
But we are not going to take any promissory notes, and especially on the issue of the Social Health Authority, because there is no difference when we are at work and when we are not at work, because we cannot be able to pre-authorize, we cannot be able to see patients through the Social Health Authority. And so we are going to remain on strike.
The striking medics lament that despite reaching an agreement with the Ministry of Health and the Council of Governors to be empaneled and given pre-authorization rights, the government is yet to implement the resolutions. But in a quick rejoinder, the PS for Health Harry Kimtai has asked them to call off the strike and give the government time to implement the resolutions, which will be complete in 2 weeks.
That clinical officers will be directly empaneled through the registered regulatory body. We call upon the Kenya Union of Clinical Officers to call off the ongoing strike to ensure service delivery in county facilities and in all facilities.
We want to confirm that indeed these resolutions will be implemented with immediate effect.
It's possible for clinical officers to be given the pre-authorization and also to be empaneled and contracted to be able to offer services. For SHA to succeed, and also the universal health coverage in Kenya, we must cover all facilities in the country. We will enable these clinical officers to be able to access the services directly.
The clinical officers have, however, declined calls by COG to suspend the strike, vowing to return to work only after their demands have been met in full. Mary Mwoki, Citizen TV.